evening, Kalamazoo and surrounding areas. It's another Thursday night here at Mount Zion, and we are thankful for the partnership of WMed and Mount Zion for this community conversation, community health conversation. I really want to thank Dr. Cheryl Dixon for making sure that this happened and this partnership, where we really want to get health information to our community. We want our community to be informed, aware, and educated about the various things that impact our lives and impact our community. So we're thankful that you've joined in tonight. Look, this is what we need you to do. Tonight we're going to be talking about diabetes and nutrition. That's a vast problem in our community that challenges us and challenges a whole lot of people. So tonight, we've got individuals that's here that's going to share information, insight, and direction, how to navigate this disease, how to present it, how to prevent it, how to get help, where the help is. So look, if you have questions, we're going to want you to put those in the chat, and we'll address those questions. But right now, before we get into it, you know individuals that need to be on. You know individuals that have diabetes that don't know what to do with it, that's talking about blood sugar, they're talking about insulin, they're talking all those terms. So if you know anybody that's dealing with any of those, we need you to share right now with them, and share and also text and call individuals and say, get on right now, get on this platform, because there's some information that's going to bless your life tonight. I'm Pastor Addis Moore, and here's a scripture. 3 John 3 says, I wish above all things that you prosper and be in good health. So guess what? It's biblical that we actually take care of our bodies and be healthy. Pray with me. God, we thank you now for another opportunity to share in your goodness. Thank you for the witnesses and the experts that you provided with information and insight that will help your people. Thank you for providing answers to questions and solutions to problems through these individuals that have come here tonight, that care about people, care about our community, care about health. So tonight now, we give ourselves to you. We give this platform to you. Use us now as instruments in your service, that your people will be what you've called them to be. We love you and we honor you now. In the name of Jesus, this is thy service prayer. Amen. Assisting me tonight is assistant to the pastor here at Mount Zion, Reverend Dr. Christopher Marcel Moore, Sr. I'm going to throw it over to him, and then we're going to introduce this tremendous panel that we've got tonight, and then we're going to jump right into it. So now get ready. Once again, share, contact individuals, let everybody know tonight we're talking about diabetes and nutrition. Get ready. Reverend Christopher Marcel Moore.
Thank you, Pastor Moore. Super excited to be here tonight for this conversation on diabetes and nutrition. And joining us tonight, we have an all-star panel of specialists, of individuals who know what they're talking about. That's why you got to put your questions in the chat. So joining us tonight, all the way from the Metro Detroit area, we have Dr. Faith Thornton. She has a doctor of osteopathic medicine, and she attended Michigan State University, where she studied human biology, public health, and osteopathic medicine. And she is a novice painter, which I guess means you are a beginner. She loves concerts and has a dog named Chica. So, ladies and gentlemen, come on, welcome today Dr. Thornton to the platform. Come on, put those hands together.
Now, Reverend Chris, now she's new to the Kalamazoo area, so tonight, this is what I need you to do. Love on her a lot, because we don't want her to leave this community, so she needs to get the Kalamazoo feel, so come on and just make sure that we just love on her. Just say her name a lot tonight in the chat.
Say, please stay, please stay. All right. To my left, we have Andrea Naud. She is a registered dietitian and certified diabetes care and education specialist at Bronson Hospital. She works with patients of all types, of diabetes, including pregnant women with diabetes. She was born and raised right here in Kalamazoo, Michigan, in the Edison neighborhood, and has a passion for helping the community learn how to be as healthy as possible. Come on, put those hands together, and let's thank God for Andrea Naud. Thank you so much for coming.
Thank you.
Now, Reverend Chris, with her name, tell me how you say her name.
Her last name is Naud, so as if you would say loud, you replace the L with the end, and you got Naud.
Yeah, all right.
Yes. To my right over here, we have Dr. Mark Schauer. He is an internal medicine physician who has been at WMed for the past 11 years. He teaches doctors in training and continues to see patients in the outpatient clinic as well as the hospital. Before joining WMed, he was in private practice in Kalamazoo for over 20 years. He's convinced that a good doctor should strive to possess the 4 C's: compassion, clinical knowledge, communication skills, and curiosity. Come on, let's welcome to the stage this evening, Dr. Mark Schauer. And last but certainly not least, we have Dr. Stephanie Elwood with us. She's a graduate from Michigan State College of Osteopathic Medicine and went on to complete a family medicine residency in Washington State. She is an assistant professor at Western Michigan Homer Stryker MD School of Medicine in the Department of Family and Community Medicine. She is currently educating future family physicians in practicing full-spectrum family medicine here in Kalamazoo. Come on, let's welcome to the platform tonight, Dr. Stephanie Elwood. Come on, put those hands together. So, Pastor Moore, this is our all-star cast we have tonight.
All-stars.
All-stars.
Yes,
Yeah.
yes, sir.
So, your questions tonight, please put those in the chat. We're contracted to answer your questions. Whatever question you have as it relates to diabetes and nutrition, please put those in the chat, and we'll entertain those questions tonight. Thank you so much.
All right, so let's jump right into it. And so I'm going to start with Dr. Thornton. I'm going to start with her tonight. And here's a question that I want to pose, Dr. Thornton, because I've heard, first of all, this disease is all over our community, and a whole lot of people, extraordinary number of African Americans, people of color, are dealing with this disease. So the question is there a reason why people of color have more complications?
Good
That's a good question. I would say historically in this country there are racial disparities, and usually minorities have different access to things. A lot of times it can be issues with access to care, access to healthy foods. With diabetes, particularly, diet is going to be really important, and unfortunately, healthier foods just cost more. Also, within the African American community, there's a family history. So I think it's really important to be aware of your family history and know if you're at a higher risk. Other things would be just maybe culturally, fear of going to a medical professional, fear of going to the doctor, fear of the unknown. I think culturally we can work on being enthusiastic about going and get our yearly checkups and being aware of our numbers so that we can have early detection and better outcomes.
I heard that. Now, Dr. Showers, help us now because, wow. So what is diabetes? What is it?
You know what? Let me just check your mic, see if it's on. Yeah, I think that's a good thing to do. All right, because we want to make sure we hear what you got to say. All right, go ahead.
Better watch what I say now then, right? Simply put, diabetes is an elevated blood sugar, but it's much more than that. I'm an internal medicine doctor, so I mostly see adult patients, and we see patients who have type 2 diabetes or adult onset diabetes, and it is a resistance to the insulin that individuals are making, the patient, and then eventually the cells in the pancreas, the beta cells that make insulin, wear out, and then it's a lack of insulin. So because of that, there is a wide variety of complications that can arise from that, and they affect almost every part of the body.
So that word insulin, so insulin just isn't something that we get from a tube. Insulin is something the body produces. Is that what you're saying?
It is, yeah. The pancreas produces insulin, but the pancreas has other functions too. It releases a couple of hormones right into the bloodstream, insulin, and then a counter-regulatory hormone called glucagon. It also produces the digestive enzymes we need to break our food down and absorb it.
Okay.
Yeah.
So, huge question is then what is insulin? Like, and why does our bodies need insulin?
So insulin allows the blood sugar. So the main source of energy of the body for most of the body is glucose, is sugar. So table sugar is sucrose, which is glucose and fructose. So it's a combination of two simple sugars. And the one that our body uses is glucose. That's the main energy source. For that glucose to enter cells, it needs insulin. And so insulin is produced in response to meals because the blood sugar elevates them. So insulin is kind of is the key that unlocks the lock, allowing the glucose to enter cells.
Okay.
Okay, so if there's a lot of people watching now, so doctor, what are some warning signs that I may have diabetes that I probably need to check something out, probably need to do some things, because oftentimes it flares up and then it's like full grown before we understand what's going on. So what are some warning signs that I may have diabetes?
And I'm sure at some point you're going to have one of us talk about prevention and one of us talk about screening so that you don't get that surprise.
Amen.
But that is not a good surprise. So one of the things you may notice from an elevated blood sugar could be increased thirst and increased urination. Mm-hmm. You can have increased appetite and actually have some weight loss associated with it, which isn't necessarily a good thing. You can have blurring of vision because of swelling of your cornea, the outer part of your eyeballs. And also the elevated blood sugar can affect it too. And those are more mid signs. Those are not really early signs. And really early on, there are no symptoms. Mm-hmm. Yeah. And that's when you want to find this out in the pre-diabetic range. Yeah. Mm-hmm.
Wow.
Yeah. So looking at diabetes then, somebody actually put a question in the chat here, and I'm trying to get back to it. It asked, the question is, why is one put on, I don't know how to say this, metformin, is that correct? Mm-hmm. Why is one put on metformin or insulin when they have pre-diabetes?
So I guess I'll take this if that's okay. So when we're looking at pre-diabetes, so that's the risk or kind of that precursor to full-blown diabetes. So it's saying that your body's rate of responding to insulin is starting to become a little less and a little less and a little less. So it takes maybe more insulin for your body to do the same thing that it normally does with blood sugar. And so when we're looking and thinking about pre-diabetes, we can consider medications such as metformin to try and help with prevention of going into diabetes. But that usually is after we try all the things with nutrition and exercise and other things we'll talk about with prevention. And so you may be, asked by your physician or your provider to start a medication like metformin to try to help prevent going into diabetes after you've done a few other things to prevent that.
Oh, wow. Okay, and we slip it in there, because I heard some words there that triggered a thought. You said nutrition and exercise. So can you speak on to that? Why is that important, and what does that help do as far as our bodies are concerned? And how important is that? And we got a dietitian, so.
Yeah, I was going to say I'll totally hand it over to our wonderful dietitian here. I guess the only thing I'd say is about exercise. That is, I think, sometimes underrated and can really help with what we talk about is that insulin resistance or the body's ability to use what's already there. And exercise is a really important factor for being able to say to your body, oh, there's insulin here, can I use it appropriately? And so, but I'll let all the nutrition go to.
But while you're talking about exercise now, you're not talking about running the Boston Marathon.
No, definitely not.
So can you say exercise? Because some folks are like, okay, I don't want to exercise. Talk about what we really need to do. Like, you need to move, is that right?
Yeah, walking. That is probably one of the best exercise you can do. And usually, it's good to consult with your provider about when to start something if you're concerned about starting any kind of exercise. But walking is generally very safe. And even just a brisk walk, several times a week can make a really big difference.
Okay, let's give me a time now, because we're trying to help somebody, because I'm feeling somebody out there, you're not moving, and you probably need to move. So can you give me 10 minutes, 15 minutes, 30 minutes, what?
Even 10 minutes, if you've not moved and are going from 10 minutes, a couple times a week, that can make a big difference. There are some guidelines for patients that are trying to prevent diabetes or other heart conditions that they usually say about 30 minutes a day of aerobic exercise or brisk walking, and several times a week. But I encourage any kind of movement because I think that can make a big difference.
Let's get on to this nutrition now, because I'm always to the point like, okay, what can I do? What else can I do rather than going on medication, rather than things getting worse? So what else can I do? So can we talk about the nutrition?
Yeah, so the doctor was talking about glucose, right? And glucose, we get that from carbohydrates. And I think carbohydrates, or sometimes you hear them called carbs, really get a bad rap in the nutrition world, but we do need them. Our body uses them for energy, so we need to eat them, but there's a difference between nutritious carbohydrates and non-nutritious carbohydrates. So you really want to focus on the nutritious ones, so whole grains, fruits, vegetables, like brown rice, whole wheat pasta, that sort of thing, to really help your blood sugar, along with healthy protein. So lean meats are good, fish, chicken, ground turkey, and then you also want to focus on healthy fats. So those are the unsaturated fats, mostly avoiding, again, like red meat, cheese in moderation, that sort of thing. So unsaturated fats would be from cooking oils, it would be from like nuts and seeds and fish, including those in your diet as well.
Now, we should have got some questions on that, Reverend.
Yes, sir.
Yeah.
So dealing with the diet, if you are pre-diabetic, is there a diet program that can be created based on your medical numbers?
So not necessarily based on your medical numbers, if I'm assuming they're referring to like lab values, but I would highly recommend meeting with a dietitian. So if you are pre-diabetic, you can actually meet with someone in nutrition services at Bronson, and they can help come up with a meal plan that's tailored to you specifically based on your age, your gender, your height, your weight, and your activity level. So it's very, very individualized and can really help you hopefully avoid going into diabetes.
Okay. Another question related to pre-diabetes. If you have pre-diabetes, what can you do to stop it?
Sure, I'll take that one. So what could you do to stop it? So diet and exercise. So our body uses glucose to fuel our muscles. So insulin is really used to shift the extra sugar in the cells for us to use. So really, the best goal is just to keep as much sugar out of the bloodstream, because that's going to cause complications, which we'll talk about a little bit later. So honestly, being conscious of how much sugar you're eating, and like the nutritionist said, what kind of carbs you're eating. Carbs that are high in fiber are going to be the low glycemic index, if you guys have heard that term. You want to eat the carbs that are high in fiber, so less of like candy, sugar, and more of like whole grain breads and pastas. So from a diet standpoint, and then just using up the sugar that you eat. So the best thing you can do, like we said, is just exercising and burning off that extra energy.
We got several questions as it relates to food, unless you about to jump into this?
Oh, I was just going to say another easy way to really limit those refined carbs is to cut out the sugary drinks.
Yeah.
Just by doing that, you can really, really help blood sugar and also drop weight fairly easily too, just from that if you drink a lot of sugar.
Wow, so you mean we can't have Kool-Aid now?
Now,
Okay.
I felt that when you said that. So say it again about the sugary drinks. And look into the mic, somebody look into the camera, because somebody's listening for that. Cut out, say that again.
Yep, sugar-sweetened drinks. Not good.
Can you name some? Pepsi?
Dr. Pepper.
Dr. Pepper,
Lord.
Mountain Dew, Gatorade, Powerade,
Whoa, hold on. Gatorade,
Lemonade.
Powerade.
Body
Those,
Armor.
They advertise those to help you run. So Gatorade and Powerade too?
You don't need those unless you're playing in a football game.
Okay.
Wow.
Water.
So drink water. Okay.
Drink your water.
Couple of specific questions as it relates to diet. Should we avoid crackers and bread unless homemade?
No, I think that just goes down to moderation, portion size, reading your food labels, and again, just trying to choose more whole grains and more fiber. So when it comes to bread and crackers, really looking at that nutrition facts label, and you want to try to have at least 3 grams of fiber per serving when you're looking at that nutrition facts label. That's how you know you've got a good serving of fiber.
Okay. Another, is fruit then good for diabetes? Because that has sugar in it.
Fruit, actually, I know that's a hard one. So yes, it does have sugar, but it's natural sugar, and it's also packaged with lots of really good things for us, right? So there's fiber, and there's vitamins, and there's minerals along with that sugar. So we do want to eat fruit, but portion size is also still going to be very important. And in terms of fiber content, again, all fruit does have fiber, but if you're trying to really ramp up your fiber intake, blackberries, raspberries, and pears have the highest fiber of all fruit.
People hot on the food thing. So what about food that says sugar-free?
Ooh, that is a good one. So that is a good example of why you always want to turn it over and read that nutrition facts label, because on the front, even if it says sugar-free, there still could be some carbohydrates in it if it's made with a natural source. So if it's a food that has fruit in it or a food that's made with dairy, there still will always be some carbohydrates, so you have to keep that in mind. In order for it to be labeled as sugar-free, though, that means they didn't put any extra added refined sugar in it, so they're using a sugar substitute. So typically they're not going to raise blood sugar in the same way, I guess, that like the regular version of their product with a lot of sugar in it. But you have to be careful with those non-nutritive sweeteners, because if you eat too much of them, for some people, they can cause some upset stomach, diarrhea, and flatulence, gas, that sort of thing.
Okay.
Some people are more sensitive to them than others.
Last diet question. I know we need to move on.
They hot
yeah.
on the diet.
So, okay, how about olive oil? Is that okay to eat daily?
Yes, definitely. That is considered an unsaturated fat, which is a healthy fat. It's really good for our heart and really good for diabetes as well.
Cool. I think we're good on the diet for right now.
Okay. All right. So, Dr. Shaw, if you have diabetes, do you need a specialist?
So I think you need to have a healthcare provider that you trust and someone you have a good rapport with. I would say that you need to know your numbers. So if you have diabetes, you need to know what's your A1c. If you're taking medication where you have to check your blood sugars at home, you should be doing that and know what they are. And we can talk more about that later. And I also think you need to know what's your blood pressure, because I did watch the last meeting you had on chronic kidney disease, and one of the mentions was that diabetes is a huge risk factor for chronic kidney disease, as is hypertension, and you add the two together, and it's really a significant issue. So I think a healthcare provider that you trust and that is competent with the medication. I do think we do have patients in our clinic whose diabetes is very difficult to control, and they're usually on a complicated regimen of several types of insulin and maybe other medications. And many of those patients have been referred to a specialist who would be an endocrinologist. But I think most people with diabetes can be managed by their primary care doctor.
Okay, so Dr. Shaw, I'm going, and one of your C's was communication with patients, so I'm going to see my doctor. What questions do I need to ask concerning this whole diabetes? What should be, if he or she is not sharing that with me, what should I be asking? Because I know that we've talked about patients taking control of their health and being proactive. So, and that's one thing that really we want to challenge our community to do more of, is ask more questions and about your body. So what should we be seeking?
So I think if one has diabetes, there are certain things that physicians would recommend and other providers would recommend that you do on a regular basis, such as eye exams once a year. The physician should be directing a foot exam probably at every visit, but at least once a year. Should be monitoring the urine for protein called albumin to see if there's any evidence of kidney dysfunction. And the provider should be interested in what the blood sugars are in monitoring that. So I think from the patient's point of view, there are certain responsibilities that I think patients need to do at home, and their provider should be assisting them with that. But the questions that a patient should be asking their physician is, what are my numbers? What's my blood pressure? What's my A1c? What's my kidney function? And should be asking them, what other medication should I be taking, if that's possible, or what things can I do as a patient to take responsibility for this? Because that's really what we want people to do. I think it is important that patients have responsibility for their condition. And most people want that most people want to be able to take control of whatever medical condition they have. It's very empowering.
Mm-hmm.
Yeah.
Okay, we're about at about halfway through now, and so if you have not shared this, go ahead and share it. If you've just got on, you know how beneficial this is and how enlightening these discussions are tonight. So go ahead and share it with someone, call someone, text someone, call somebody out of the other room. They're doing something else. They're eating some of the things they should not be eating, and we just talked about it. So call them out of the room like, hey, you need to come in because you need to hear what's on, all right? And make sure you take plenty of notes, and if not, view it again on the replay, and you can do it. Get these questions in. Reverend Chris, where are we?
Yeah. All right, so let's just start tackling questions. I tried to group them, but now let's just tackle them.
Yeah, I was trying to give you time.
Yeah. How does someone become diabetic? And then the secondary question to that is, what kind of lifestyle leads to that, or is it just lifestyle?
So that's actually a very difficult question to answer because diabetes is multifactorial, so it means there's a lot of contributing factors. We think some of it can be related to your family history, right? If diabetes can sometimes run in families, and the question becomes, is it related to maybe lifestyle of that particular family? But we also noticed that I think we had mentioned earlier is developing diabetes later on in life, or what we sometimes call type 2 diabetes, compared to type 1 diabetes, where you can actually most of the time develop it in childhood, and is a condition where your body stops making insulin. And so that's a little bit different. But I think kind of related to that question of, is this all lifestyle? I think some of it is lifestyle and some of it can be genetic and family history. But there are, as we were kind of described earlier with some nutrition and exercise, there are ways to prevent that even if you have a family history.
So along with that, I think you addressed this a little bit, but is it common to develop diabetes later in life? I've noticed that I noticed that in my family that some family members developed it later in life. Could that be genetics?
It definitely could. It could be genetics, or again, sometimes when diabetes runs in the family, it's just you guys are eating the same things, have the same patterns of exercise, maybe sedentary lifestyle, maybe smoking is common in the family, high blood pressure. Diabetes is associated with a lot of other common conditions like hypertension. So in addition to going to your doctor and getting A1Cs, you want to know your blood pressure too. You want to get a lipid panel and make sure that you're aware of your lipid numbers as well. Diabetes is also considered an immunity where you have decreased immunity, so getting things like the pneumococcal and flu vaccine every year is going to be very important as well too. And just going to a dentist, really just all encompassing your whole health is really what's going to get you the best outcome as far as diabetes.
No, you just said something about flu vaccine and
Pneumococcal vaccine, yes, both.
Can you say that again?
Flu and pneumococcal vaccine.
What kind of Mikado? You said pneumococcal?
So yes, pneumococcal vaccine is going to prevent.
See, you just said something. A lot of people don't want to take vaccines. Like, oh, no, I don't want to take the vaccine. I don't want. But that can help.
Yes, diabetics are at higher risk for poor outcomes with pneumonia and
Jesus.
both flu. So definitely want to advocate for those as well.
And COVID vaccine.
Yep,
I'm gonna
COVID
put that
for
out
sure.
there.
But
So
for
What's that?
everybody,
COVID vaccine.
COVID vaccine.
For real?
For
That
real.
helps diabetes?
So if you're a diabetic, you're at a higher risk of complications directly related to COVID, and your risk of hospitalization and even death is higher. And so definitely recommend the COVID vaccine if you have diabetes.
All right. So I know we kind of hit on this question, but there's a specific question. So if both of your parents had it, are you more likely to have diabetes?
So if you have a first-degree relative, which would be a parent or a brother or sister who has diabetes, your chances of developing diabetes are at least twofold higher, so at least twice as high as somebody who doesn't have that.
Wow.
And that's just one of the risk factors. The other risk factors would be inactivity. So we talked, I think everybody has mentioned here activity. Mm-hmm. Second is if you're overweight, and the more overweight you are, the more your risk is. And then there's things you can't affect. One is if age greater than 45. So the older you get, the higher the risk of developing diabetes too. It tends to happen as we get older.
Wow.
Yeah.
Can I squeeze this question in, Reverend Chris, before you go back to yours?
Certainly.
So is kidney disease a part of diabetes? Or is there a relation?
It can be. One of the complications of diabetes is going to be nephropathy. So again, when all of this sugar is circulating in the bloodstream, it affects the eyes. You can get retinopathy, which is why it's important to see an eye doctor yearly. You can also have nephropathy, which the sugar filtering through the kidneys can cause some damage. So a lot of times people will have to have a nephrologist specialist if their kidneys get really bad. A lot of times that happens in uncontrolled diabetics. If you leave that sugar in your blood for a longer time, you have higher risk of complications. Another common side effect or complication of diabetes is neuropathy. So that's decreased sensation in the foot. So puts you at higher risk of foot ulcers. This is why when you go to your primary care provider, it's going to be really important that at least once a year that you're getting a monofilament test. So that's when we take a little, it's kind of like a plastic pokey thing, and we're just testing the sensation of your feet just to see what risk you are at developing diabetic foot ulcers.
Is that why some folk have to have their feet amputated?
Sometimes, yes. Complications from ulcers, poor blood flow, just making it hard for wounds to heal. If ever you do get sores, that's definitely something that you should get up on right away. And that would require sometimes seeing another specialist, which is the podiatrist, a foot doctor, who would facilitate that specialized care if need be.
Okay. So would a keto diet or Mediterranean diet be good? And I don't know what these are. But will they be good options for pre-diabetic?
So the keto diet?
Yes.
Yeah.
Keto.
So nutrition is very, very individualized. So I definitely recommend, again, like meeting with a dietitian to help come up with the plan that's best for you. But typically we do not recommend the ketogenic diet. It's a very, very low carbohydrate diet. And like I said before, carbohydrates are our body's main source of fuel, so we do need them. And then oftentimes when people follow a keto diet, they have to eat really high fat, and they choose fats that aren't so healthy for them. So they eat a lot of cheese, or they put butter in their coffee, or they eat a lot of bacon to try to get a lot of fat in their diet, and that's really bad for our heart. And so as you learn tonight, oftentimes diabetes and heart disease do go hand in hand, so we don't want that. We don't want to do that at all. But the Mediterranean diet is a very, very healthy diet. It's been studied for years, lots of good studies on it, and that is a great way to eat.
Wow. Another question here. Talk a little bit more about fruits. I just lost the question. Can you talk a little bit more about fruits and diabetes? And somebody just put in the chat, butter and coffee? What? All right, go
I
ahead.
know, it's weird, but people do it.
Yeah.
Bulletproof coffee.
Yep.
What about fruit?
I don't know. Anything you want? Yeah.
Any fruits you should avoid?
So no, not really. It's just going to boil down to portion size. So we don't want to sit down with, like the whole container of the cut up fruit from Meyer. We don't want to eat that all in one sitting. But if we get like a cup of it and go sit down and eat it, that's okay. So it's all about portion size. And if you do have diabetes, again, protein is really important too. So if you have fruit, try to have a little bit of protein with it, like maybe a handful of nuts. And that can really help slow down absorption and stop blood sugar from rising quite as quickly.
Okay. Can you talk a little bit about oral health and how that helps to manage your A1c levels? And somebody said oral health gets overlooked sometimes.
Yeah, I think if we're talking about oral health, it's really important because we think about sometimes when you have diabetes or you're at a higher risk of many types of infections and being slightly immune compromised or describing your immune system maybe not having as full effect. And so your oral health is actually a really important factor for your whole body health. And so seeing a dentist or a provider that can help with your oral health is really important, usually twice a year.
A couple of more, and I think we're just about caught up, but please put your questions in. We got about, 23 or so minutes left. Somebody even said, this is very helpful, bye Gatorade. So
Amen.
you help somebody. Is chronium a good vitamin to purchase over the counter to help with sugar control or weight loss? I don't know what chromium is.
Is there an M in that?
Yes, an M in that, Opie.
So the thing with vitamins and minerals in terms of blood sugars, they're not studied super well, and also the supplement industry is not regulated by the FDA. So while it might say it's chromium on the bottle, that might not actually be what's inside of it, unfortunately. So I'd be really weary about taking any vitamins or minerals to help with blood sugar. Instead, you should definitely speak with your physician and come up with a plan that's going to work best for you. And if you are taking anything like that, definitely let them know.
Okay, another question. What are lipids and what do they reveal?
Lipids are the amount of cholesterol in your blood. So having elevated lipids are dangerous because it can get stuck to your arteries and cause cardiovascular disease, so heart attacks and things like that.
Okay. Is there a way to get off of medication if you are on insulin?
I'll take that.
Yeah, go for it.
There's a number of different medications and some newer medications that are helpful in controlling diabetes. And I think if you look at what's the most essential thing to control diabetes, even if you're on insulin, would be diet and exercise. And I don't think we've mentioned smoking yet, but not smoking, because what you're trying to prevent are both large blood vessel disease, so as Dr. Thornton said, heart attacks and strokes, macrovascular disease, and peripheral vascular disease, that's lack of blood flow to your feet. And microvascular disease, like she had stated also, is which affects your eyes, because that's the most, diabetes is the most common cause of blindness in adults. Wow. Diabetes is the most common cause of kidney failure in adults, especially when added with hypertension. So I will say, though, that there are newer medications, and some of these, without going into great details about the medications, there are some where we can decrease the dose of insulin, and some of them actually, if patients are working on changing their dietary habits and exercising, that they actually can reduce the dose of insulin and potentially get off. Depends on the circumstance, and depends if their pancreas is still making insulin. Because as the disease progresses, the amount of insulin that's produced will be insufficient. So in some patients, sure, but I wouldn't do that without further discussing with your physician. Yeah.
Can diabetes be reversed?
Say yes. So in some aspects. With diabetes, what numbers we were kind of talking about or asking your physician or provider about your number is a big one we use is A1c. So that's one way we actually diagnose diabetes. Your A1c is like looking at what your blood sugar has been doing for 3 months. So it takes a look at the red blood cells, the cells that are running through your bloodstream, and really kind of counts the sugar along those cells. And you can see that over a 3-month period and takes that average. And so when we're looking at your A1C, so I've had some people that we've worked with that have been able to have a very high number for their A1C, which means their blood sugar is very high most of the time. And with diet and exercise and maybe medications, they've been able to bring it into a normal range. And over that time, sometimes they're able to get off medications. And technically, we don't say that diabetes is completely reversed unless you're back into that normal range for several years. So it's something that takes time and sometimes, but can happen.
A couple of more questions, and I think we're caught up. If I missed your question, retype that and put it in the chat. We definitely want to make sure we answer your question. Could you talk about metformin and metformin XR side effects?
Do you want to handle that?
Metformin XR is the extended release of metformin. A lot of the times, most side effects with metformin are going to be gastrointestinal issues, upset stomach, diarrhea, things like that.
Okay.
I would say the XR version tends to have a little bit less of that. So if you take your metformin, the other is more of a quick release, and the XR is a sustained release. And if you take the XR, if the regular metformin causes nausea or causes diarrhea, then you can use try the metformin XR, the extended release, and take it with food. And it's often better tolerated, and maybe start at a lower dose and then gradually work up.
Okay. Why can't diabetics clip their own nails?
I think this goes back into, sorry.
I've never heard that they couldn't. This is news to me. Go ahead.
Yeah, I wouldn't say that they can't, but going back to the neuropathy, you're losing sensation in your feet in particular, so it just makes it a little bit more dangerous. You want to be careful just not to get any sores or cuts because healing will be a little bit altered due to the blood in the bloodstream and decreased sensation.
Wow. Can you talk about some of the challenges you see with treating diabetes in the Black community?
Yeah, I think one thing, and we hit on that a little bit before, is trust. Is trust in a physician or provider, but trust in the medical community in general. I think that remains an issue in the African American community, and I think as a physician, trust is earned. You know, when you see somebody that has an interest in what you're doing and pays attention to what you're saying and cares about what medications you're taking, then you're going to be more likely to trust that individual to provide good care for you. I think another thing that affects it that Dr. Thornton talked about earlier is oftentimes there's inadequate access to good food because they cost more, and access to health care in general. So.
Okay. What is a normal A1c range? And then somebody else put in the chat, A1c is a snitch. It tells all your business. All right, so what's a A1c range? What's a good A1c range?
You want it below 6.5, but also below 5.4, I believe. 5.4 to 6.5 is pre-diabetic, I believe, yes?
5.7.
5.7.
Yeah,
Okay.
so anything above 5.7 is what you were describing, or
Yep.
what we were describing before. The question before was pre-diabetes. So if you're thinking about your risk of developing diabetes after 5.7 for your A1C, you're considered in the pre-diabetic range, and then greater than 6.5 is considered the diabetes range.
And that's when you need to ratchet up the diet and exercise, and you really need to start watching what you eat and how you take care of your body. Is that correct?
Exactly. And I think especially if you're able to do this, because I think we described before, is a lot of this is not symptoms. You're not really developing these signs of diabetes when you're in that range, but your body is at that point in that range now saying it's time to do something different so that I don't develop these symptoms and don't go develop some of these complications.
I like what you just said, and I think that's important. It's time to do something different, because oftentimes we will do the same thing and expect results. So the body is saying, okay, now it's time to do something different if I really want to maintain my health. Awesome.
Yeah. Just a couple of comments here from good oral health helps manage A1c levels, a fact that gets overlooked. Inflammation, periodontal disease contributes to uncontrolled diabetes. And a healthcare worker chimed in and stated, I see a lot of resistance, relationship building, as you said, is so important, as is speaking in a language that the patient understands. That's cool. And we're seeing that diet and exercise is key. We're seeing that get across. What is, we heard type 1 diabetes, type 2 diabetes. Is there 3 and 4? I mean, what's type 1 and type 2? Or 3, 4?
Yeah, it can get a little complicated. So usually, as we described, type 1 happens when your body stops making insulin, usually as a little kid. And so they'll develop a pretty severe condition, and then we'll find out that they are no longer making insulin. It might be that their body actually destroyed the part of the pancreas that produces that insulin. And that is usually type 1 diabetes. We can sometimes see that in later in life, and I think we described even in type 2, when your body is not responding to the insulin is the way we think of type 2 diabetes. That sometimes can still eventually progress to where your body is not making insulin in the later stages when diabetes hasn't been controlled for a very long time. There are other special diabetes, like mature onset diabetes or MODY. You'll hear those terms. Those are rare, but sometimes can develop if there's other issues with the pancreas. So maybe it's, and then eventually the specific part of the pancreas that produces insulin is also affected. And so you can have these different types of diabetes other than 1 or 2, but 1 and 2 are 2 is the most common, and 1 is the other one you'll hear very often.
Is there a diabetes 1.5? Somebody asks, is that a real diagnosis?
That's called LADA. Yeah.
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 What's it called?
LADA, L-A-D-A.
Uh-huh.
What does LADA mean?
Go ahead.
1.5.
I don't remember.
It's like
a latent adult.
Yeah, it's a slow progressing form of type 1, basically.
Yeah.
So
Okay.
type 1 diabetes usually happens really quickly. People get really sick really fast when they develop type 1. LADA is just more slow moving, I guess, in a sense. There's also gestational diabetes, which is diabetes that only happens during pregnancy, and usually once the baby is born, the diabetes goes away.
Gotcha. Is there a resource we can look up or find about healthy eating and nutrition?
Google is hard because you can find so many good things, but so many bad things too. So I would definitely recommend starting with the American Diabetes Association. Go to their website. They have a lot of really good recipes that are really easy to follow and also have the nutrition information listed on them as well. And then, just a little plug, but if you do have diabetes, you can ask your doctor for a referral to Bronson Diabetes Education, and you can come and see both a dietitian and a nurse, and we can teach you all about every aspect of diabetes, from nutrition to pathophysiology, so what's really going on in your body, to what those blood sugar numbers mean. Diabetes A to Z.
So with that, though, with the dietitian and with the referral, and we talked about there are some foods that are complicated to get for certain individuals. So does that come with resources as well to help
Yes, yep. We definitely meet you where you're at and help you come up with a plan that's going to fit within your budget and your resources and point you in the right direction if you should need additional resources as well.
So, Dr. Shaw, are there any medications that we should avoid as we're dealing with this whole idea of diabetes?
Sure, and I think one of the things that was mentioned actually with the chronic kidney disease is really avoiding the non-steroidals, which are Motrin, ibuprofen, Aleve, which is naproxen. Those are things that can affect kidney function. They don't necessarily affect diabetes itself or affect your blood sugars, but they can cause further complications, right? And I think alcohol is a drug that is commonly used, and we used to say, oh, a glass of wine at night is probably healthy, and in general, I don't really think there's any amount of alcohol that's good for you, but there is probably some that's less harmful, so moderating things that we do like that, yeah. And nicotine, forget it. You shouldn't be smoking, you shouldn't be vaping, you shouldn't be using tobacco in any means. Yeah.
Gotcha. How about, we got a question, because earlier we were talking about that access to food is more difficult for some folks and can't afford it. So what about canned fruit? Is that good? Or frozen fruit?
Frozen fruit is going to be just as good for you as fresh, if not better. Usually it's flash frozen right after it's picked, and so it holds on to more of the nutrients. As far as canned goes, that can be just as healthy too. You just want to make sure that you're choosing canned fruit that's in its own juices, not in syrup, and then not drinking the juice that's in the can.
I'd like to ask our dietitian one question, though, too. So what about fruit juices? Because I don't think we mentioned that yet.
We haven't talked about that. We did. I talked about sugar-sweetened beverages, but juice actually falls under that category, and oftentimes people think juice is really healthy, but it's not. So a serving size of juice is about 4 ounces, so it's like a tiny little shot glass. And that has 15 grams of carbohydrates, or is considered like a serving of fruit, just in that small little glass. The only time I really recommend drinking juice is if you don't have access to fruit and that is your only source of vitamin C in your diet, then you could have a little bit of juice. But again, it's just a tiny, tiny little sip.
So the fruit is good, but the fruit juice is not.
Yes.
Wow. Wow.
Those Bolt House Farms drinks, have you guys seen those at the store? Don't buy those. They're made with good ingredients. They're very natural, but they have so much fruit. Way too many servings of fruit in one bottle.
How about smoothies? You know, from these, I'm not going to publicize any place in particular, but, you know, a smoothie place that's like a cafe.
So again, it just depends on how many servings of fruit they're putting in there. Typically, it's going to be more than 1 serving of fruit, and we just don't want to be putting that much in our body at one time.
Okay. How often should you test blood sugar? After every meal, first thing in the morning, just hanging out there?
We recommend that diabetics that use insulin check their sugars on a daily basis. Most individuals who control their blood sugars with oral medications, it'll be more important for you to go to your physician at least every 3 months just to get those A1Cs, to get that average of every 3 months. It becomes important with diabetics who use insulin in particular because you don't want really big sways in your blood sugar on a daily basis. So with a lot of diabetics, they'll check it first time in the morning when they haven't eaten anything, fasted, and then checking it after your meal, 1 or 2 hours after your meal. And then sometimes people will have sliding scales to give themselves additional insulin based on that number. So more important in our insulin-dependent diabetics.
We've got about 6 minutes left, and we've got a wealth of information first. And let me thank each of you for your sharing your knowledge and your caring for the community. One question I'd like to ask every person, what's the most important thing that people need to know to prevent complications if they have diabetes? And we can throw in there anything else you feel like we need to know. And like, here it is, let's do it. We'll start here and we'll come around.
So probably one of the most important things if you have diabetes is to see a healthcare provider so that they can help partner with you to be able to meet your needs and your values, to be able to treat you the best possible we can and reduce those complications. I would also say, I think for mental health and also diabetes, walking, if you can, if you feel safe in the space that you're at, I would highly recommend it. It gets a little tough in Michigan sometimes.
Thank you.
So as we've been talking about, nutrition is super important, right? So I think, again, if you have diabetes, really trying to get in and meet with a dietitian to help you come up with a game plan. But in the meantime, what you can do is really focus on what your plate looks like. So when you're sitting down for a meal, try to have half of your plate be green, non-starchy vegetables like a salad or broccoli, green beans, asparagus, that sort of thing for your fiber. A quarter of your plate, a healthy lean protein, and then a quarter of that plate, a nutritious carbohydrate food. It's a very balanced meal and typically does very well for blood sugar. So that's a really good starting point.
Okay, so half of my plate green, and then a quarter of it lean,
Lean.
Okay.
Green, lean.
and the other quarter,
Carbohydrates.
okay.
Healthy carbohydrates.
I laugh because, a lot of meals are centered around the meat. So we get the meat and then we say, well, what side you want? so really the meat is the side.
Yeah.
Wow.
That's a good way to think about it.
Yeah. So the main dish is the veggies, and then the side is the meat and the carbohydrates.
Yep, you got it.
Oh, I got some adjusting to do.
I would say know your numbers. Early detection is really going to be the best to get the best outcomes. So even if you feel like you're healthy and you're proud that you haven't seen the doctor in years, don't be proud of that. Come see us every single year. Know your blood pressure, know your A1c, know your cholesterol levels.
Nice. I would say take ownership for your condition, for the diabetes, but don't let diabetes define who you are. Recognize you're a person who has diabetes. You're not a diabetic.
Yes.
So take ownership for it, but don't let it define you. Get off the couch, go for a walk every day, 150 minutes of exercise a week, and then really work on diet. Diet and exercise makes a huge difference. And I'll add one more thing. There was a study about 10 years ago that compared one group of patients who were put on metformin who had prediabetes and another group who aggressively pursued diet and exercise changes. And didn't take metformin. The group that pursued aggressive diet and exercise had better control, and fewer of them went on to have diabetes during the time of that study. So what you do makes a big difference.
Yeah.
Wow, and I love that, Dr. Showers, that we need to take ownership, and just want to push that. Let's do what we can do. We can exercise and we can control our diet. That's what we can do. Thank you for that. Reverend Chris, any other questions we got to get? We got about 2 minutes as we're wrapping up. And any of the hot questions that individuals got in just before the wire?
I'm good, sir. I didn't see any last minute ones pop up on my screen here.
Look, this has been phenomenal. Come on, give us some thumbs up, give us some hearts. This has been powerful tonight, and I definitely want to thank WMed for their partnership as we come to the community with these health conversations. Let us know how beneficial this has been for you. Give us feedback as far as more things you would like to have more information on. We're actually contracted to try to answer any question as far as health is concerned. We can get the individuals here to talk about it and to answer your questions. We just need you to tune in and have others tune in that have health concerns that have gone unanswered. We really want to make sure that that comes to you in a way in which you can understand. And even some of the things, if you want more information on what you've heard tonight, please contact us. And so thank you so much, very much for coming. Dr. Showers, Dr. Thornton, Dr. Reverend, help me.
Dr. Elwood and Andrea Nowd.
Amen.
Thank you so much for tuning in tonight. Father, we bless you. We thank you for what we have experienced tonight, what we've heard. And you've given us these temples to be stewards over. So we're going to be good stewards, and we're making adjustments now because of what we heard. We thank you, God, for those that you sent to pour into us tonight. In the name of Jesus Christ, amen.
I want to thank those that's in the studio audience that came in tonight, so virtually, and those that are in the studio audience. Thank you so very much for coming. Thank all of the Mount Zion production crew. Thank you for your efforts for making this happen tonight. And look, we'll see you this is April.
Yes.
See you in June for another conversation. Thank you for watching.